Hi there, welcome to another episode of Time with Dr. Adams. Today I'm doing another video on fibroids. Seems a lot of people are asking questions, so I'm redoing this video on fibroids. Please, if you are new to my channel, my name is Dr. Saki. You can call me Dr. Adams. If you haven't subscribed, please do so, and let's start. Thank you. Time with Dr. Adams. Hi, so welcome back. Thank you for subscribing. Thank you for watching. Today we are going to talk about myths and then the real truth. It's not every myth about fibroid that you've heard out there is the truth. Now I'm here to tell you the truth. So number one, someone sent me this, that virgins cannot get fibroids. It's a myth and it's not true. Virgins can get fibroids. You can grow fibroid. A fibroid, it can grow in any woman with a uterus. So far as you have a uterus, virgins also have uteruses. So if you have a uterus, it means fibroid can grow inside you, whether you're a virgin or not. Please, this is a myth. Fibroid is not an accumulation of menstrual blood. When I hear this, it sounds so funny. It's just people who do not really understand what is happening who put this thing up. Please, fibroid is a muscle. It's a growth. It grows in your muscle. It's a growth. It grows in the muscle of your uterus, okay? It is not any accumulation of blood. Please, pregnancy does not cure fibroids. I'm going to tell you there's only one cure for fibroids forever. If you want your fibroids to be cured forever, there's only one cure. Pregnancy cannot cure fibroids. However, your pregnancy can grow with your fibroids. Yeah, it's true. Continue listening for more Apple. Please, this is a myth. I've seen lots of women who've gone ahead to have 2 more kids, or even 1 more kid, or 3 more kids after they had their fibroids removed surgically. I repeat, after you've had a fibroid removed surgically, you can still go ahead to have a child. This was so funny to me. It's like this was kind of comparing a fibroid to a baby. Yes, the fibroid can grow side by side with your baby. It is possible. But when it comes out, please, it will grow hair. It's not true. It's not true. So I had this when I was working in Koforidua Market one day, that they are going to give you some herbal preparations, and then the fibroid is going to fall out of your vagina like a yam. Hey, that is dangerous. So because fibroids are connected to the muscle of the uterus, and the uterus has lots of vessels, blood vessels. So if it falls out of your vagina, it means you are going to bleed to death. Or any day, instant death. Please, it's not true. It won't fall out of your vagina like yam. Yes, after you've had your fibroid surgically removed, it can grow back. It doesn't mean it will grow back in every woman, but there's a high possibility that it might grow back after you've had a surgery. Yes, look at me. I went to work. I have 2 kids. I'm here. I cook. I do everything. Yes, I have fibroids. So you can go about your daily duties if your symptoms are not so severe. Now, when it comes to most symptoms, we have mild, moderate, and severe. So let me just say that I have mild symptoms. So if your symptoms are mild like me, you can go about your daily duty. But if your symptoms are severe and you're severely anemic, that you can go about your daily duty. So it depends. No, please. Fibroids are found in your uterus. So when they are surgically removed, all your internal organs are fine. Nothing has happened to them at all. They are fine. No, surgery is not the only way to manage fibroids. We have other ways. We can put you on medication. We can also surgically remove it. But to know the best cure and the only cure for fibroid, continue watching this video. Yes and no. I'm here. Fibroids hasn't caused me to lose my uterus, and I have 2 kids. However, if your fibroid grows so big and it occupies your whole uterus and you are having terrible symptoms, then you leave your doctor no choice but to surgically remove everything. And since the fibroid has taken the whole space of your uterus, it means they are going to take your uterus out completely, and that is what we call total hysterectomy. So if your fibroid is like this, small like this, we won't remove your uterus. We'll probably not even operate on you. If your fibroid is growing and is big and you're having symptoms, we can just take the fibroid out. But if your fibroid grows and takes the whole space in your uterus, then please, you might lose your uterus when we take the fibroid out. No, it's not some kind of magical. It won't disappear. However, it will shrink. Now listen, fibroid, it's like a vampire. It loves blood and it also loves hormones. When it comes to menopause, any woman who is in her menopausal age, it means some hormones, female hormones that you used to produce when you were younger, you are no more producing those hormones. Fibroids also love those hormones and they feed on those hormones and blood. So fine, your blood circulation is still fine, but then your hormones, your female hormones, because you are in your menopausal age or because you are in menopause, you don't have those hormones again, or they have reduced. So if those fibroids are not getting those hormones, they will start shrinking. They will start shrinking. Like my mom has fibroids. When I don't tell you, cry, you wouldn't know. Me, I had 2 kids and I delivered all of them through my vagina. Why? Because my fibroid was not located where my cervix is or where the baby will pass. However, if there's a woman whose fibroid is located around her cervix, so let's say this is your cervix. I have a video on that on TikTok. You can check what I mean by cervix. So if this is your cervix and then your fibroid is covering half of it, see, if baby is coming up, baby can't go through it. Baby can't go through it because the fibroid is occupying half of the cervix. So it depends. Me, my fibroid was not located around my cervix, so I was able to give birth to 2. How many more? Let's ask my husband. Yes. So now that we've spoken about all the myths and then the questions people ask me, let's talk about what fibroid. What is fibroid? It's a non-cancerous growth in the uterus. I repeat, it's a growth. It grows in the muzzle of the uterus. The uterus itself is a muzzle. So just imagine if this is your uterus, and then suddenly you find this place growing bigger and bigger and bigger and bigger. Now that is a fibroid. It grows only in the uterus, no other place except the uterus. Up till now, researchers have been done so many times, but they've not really found the particular cause of fibroids. So for us, you're a woman, you can have a fibroid, all right? But we have what we call risk factors. Risk factors means the possibility of you getting fibroid is very high. For example, black women. Yes, if you're watching this and you're a black woman, and you and I, our possibility of getting fibroid is very high as compared to the white women or the Caucasian women. All right. Another thing is family history. I made mention that my beloved Mama Lou, that's my mom. They found out that she had fibroid, I think when she was around 40 years. So my mom has fibroid. So when I also found out I had fibroid when I was carrying my first child, that's boss baby, it wasn't news. It wasn't what is happening, because there's a family history. So yes, boss baby, my first child, is a girl. If she grows and later on in life she also develops fibroid, it's in the family. And she might or might not, but it's a risk factor. It means her chances of growing fibroid is high because I have it and my mom also have it. All right. Another thing is women who abuse oral contraceptives. Yes, that is why we tell you, oh, if you want to use any medication, go and talk to your doctor. Oh. I'm not saying anyone on oral contraceptives will grow fibroids. What I'm saying is that abuse of oral contraceptives can increase your risk of getting fibroids. Other things are women who are obese. So please go to the hospital, check your BMI. If you are obese, you might grow fibroids. Women who drink alcohol or smoke, all these things are risk factors. Okay. What are the signs and symptoms of fibroids? Bleeding heavily. I realized before I had Boss baby, before I gave birth, I was bleeding heavily. And even as a doctor, because my tummy wasn't growing that much. But when I detected that I had fibroids, I was like, that is why, especially the first, I'll bleed heavily and in clots. Now, let's not take this symptom lightly. There are women who bleed heavily. When I say heavily, very much. I know a friend, she's a nurse. I think she shared her story on social media. She'll wake up and all her bed will be wet, especially when she's in the menses, will be wet with clots. So she had to go in for a surgical procedure. Yes, because it was that bad. Now I bleed heavily. I'm mildly anemic almost all the time, especially after I have my menses. But then I'm okay. So your symptoms might not be like mine. So bleeding heavily, and then probably you might before you might have been bleeding 3 to 5 days, then suddenly you are bleeding 7 days and more. That is a sign that you might have fibroid. Another thing is you suddenly might start losing your shape. Now we can look at my shape. I have 2 kids and this is my shape. Nothing is showing that I have fibroids. However, there are some women that you will think that they even have they are pregnant or there's something there because their abdomen will change in shape and in size because the fibroid is growing. So this one is not specific. Your tummy might become big or might not become big. Another thing is you might have lower abdominal pain, especially when you are in your menses, which we call dysmenorrhea. We have primary dysmenorrhea and we have secondary dysmenorrhea. So extreme menstrual cramps can be as a result of fibroid. Another thing is you can be urinating often or you can be having constipation. Let me explain. So the fibroid is always found in the uterus. So this is the uterus. In front of the uterus is your bladder, where your urine collects, and behind your uterus is your rectum, where your feces collect. So if your fibroid grows in the uterus and it bends towards where your bladder is, where the urine collects, then you'll be urinating often because small time it will press on the bladder and then you have to urinate. But if your fibroid is going in this direction, where your rectum is, that is where your feces collect, you might be having constipation. Okay. Another thing is infertility. Yes, I know this is a big problem. I had a church member who was dating someone and then the person found out that she had fibroid. I think she willingly told the man, and somehow concerning the church quickly spread like fire that this girl has fibroid, so she cannot give birth. You want to know more? This woman is now married with 3 kids because the person was wrongly and poorly informed. Yes, if you have fibroid, it can cause infertility, but it doesn't mean everyone. Me, for instance, I have fibroid. My fibroid is small and I have 2 kids. It also depends where the fibroid is and how big. Now, fibroid, like I said, grows in the muscle. The uterus itself is a muscle, so it grows in there. So depending on where the fibroid is, it can be intramural, submucosal, subserosa. It can be found around the cervix. It can be like in the form of a polyp. Wherever it is found, that's where your symptoms or your signs will show, or whether it will cause infertility in you or not. So for this lady, hers was big and it kind of started showing on her abdomen. However, she was still able to give birth to 3 kids. So it doesn't mean everyone who has fibroid will not be able to give birth or will have infertility issues. So if the fibroid is big, and then the baby, you get pregnant, there's a possibility that, like I said, the fibroid loves hormones and blood. So it can be present on the baby, then it will cause abortion, or it will not give space for the baby to grow. So for such things, we will take the fibroid out so that the pregnancy can get space, or the baby can get space to grow. Another thing we can do is sometimes the baby and the fibroid will be growing together, like mine. They grew together and the fibroid is still there. One of my good friends, the fibroid grew with the baby, and when she was operated on, they were almost the same size, or I can even confidently say that the fibroid was even bigger than the baby. But they grew together in the womb, and when she was pregnant, you might think she was carrying triplets. All right, so it can cause infertility, but whatever it is, talk to your doctor. Don't sit at home and say, hey, I have fibroid, so you are condemned. No, maybe, and most of the time, something can be done. All right, so it brings us to diagnosis. If you have fibroids, your symptoms, and then we can also take an ultrasound, or we will take an ultrasound to know how big your fibroid is. Where is it? If you'll be able to deliver vagina, or it's going to obstruct you, we can do all this. Now let's talk about the management. The management depends on your symptoms. Before I gave birth, I had heavy menstrual flow and I had dysmenorrhea, that's extreme or serious menstrual cramps. After giving birth, still with my fibroid there, I still have heavy menstrual flow, but then I don't have cramps anymore, you see. So if I'm going to treat my fibroid, I probably might have been taking painkiller to help with the pain, and then maybe blood tonics to help with my anemia. All right. However, there are some women that their symptoms are so bad we have to put them on hormones. But you have to discuss this with your gynecologist obstetrician. All right. And there are some people that we have to do what we call myomectomy. So this is the uterus, and if your fibroid is growing here, we'll take the fibroid out and your uterus is still intact, meaning you can still get pregnant and give birth. However, there are some women that the fibroid will grow and take all over the uterus. For such women, if we realize that you have kids already, or you are elderly, you've grown, you are an elderly woman, we'll give you the option of totally taking out the uterus. Now that is the only cure for fibroid, because when we do the myomectomy, there's a possibility. The myomectomy means taking out just the fibroid and leaving the uterus. It means you might grow back the fibroid. But when we take the uterus out, which is the total hysterectomy or hysterectomy, there's no uterus, so the fibroid will not have any place to grow. But we only do this removal of uterus or hysterectomy in women who are elderly, or women who don't have any plans to give birth, or they finish giving birth to all their kids. Let's take me for instance. Let's not tell my husband, maybe I might give birth again. But let's take me for instance. I have 2 kids. And if my fibroids grow as the size of my uterus or takes over my whole uterus, I can go in for a hysterectomy. Even if I speak with my gynecologist and we are like, oh, have you finished giving birth? And I say yes, then he might suggest, let's go for a hysterectomy so that you will not have any symptoms at all. So fibroids, the symptoms can be mild, moderate, severe, whatever it is. Go to the hospital. Can it kill? Yes, fibroids can kill you. How? You can bleed so much. You'll be sitting in the house doing your own concoction, listening to people, and you bleed so much, you can get severely anemic and die. Yes, there's that possibility. And then you can also choose to have a nice life like me. Mine is small. I'm having mild symptoms. I've spoken to my doctor, my obstetrician gynecologist, and we are not touching it. My mom's own, for instance, she found out around 40 years or 45 years. She spoke to the gynecologist and she said, you know what? I know you're having symptoms. I'll give you medications to treat this, but I don't want to surgically operate on you. Why? Because you are going towards menopause, and when you reach menopause, the hormones that the fibroids like, they will not be there anymore. So the fibroid will start shrinking. And true. My mom's tummy was like this. When she went to menopause, it has come back down. It's not flat, but it's not as big as it was before. There's also this type of surgery we do, uterine artery embolization. We inject some medicine into the vessels around the uterus where the fibroid is, and it seizes blood flow to the fibroid so it won't grow anymore. Whatever it is, go to the hospital, talk to your doctor, be helped. Fibroid shouldn't kill anyone, any woman, because definitely something can be done. Please, if you have any questions, let me know in the comment section below. I'm going to do a tree version of this to help our sisters who are not able to understand the language. I wish I had people helping me to translate this into other languages. Let me know if you think you can help. Thank you. Don't forget to subscribe. Bye.
Time with Dr.